Join us as we delve into the world of respiratory infections, exploring conditions like COPD, asbestosis, croup, SARS, and RSV. Get ready to learn about their names, classifications, causes, mode of transfer, symptoms, target age group, attack rate, and home remedies. Now, let's dive in.
Kita mo lang kung kayo nilapit ko rin. Nagtatabi this weekend. Hindi ako sure if pwede na para sa ako. Nga, nga, hindi ko nakapoy Diyan, di ba kabalo pa man nga ng COPD ako. Hindi ako pwede na kayo para sa tapunan. Oh, sige na ba lang pero mo lang ginagamit ang COPD mo sa excuse. Ano ba malala? Bilang imong sakit. Ano, kung nakabal-hambal kang kabalo, pag-get sa mga agyan ko everyday ba? Ay, ginabuligan sa malang ka mag-enjoy sa life mo. Hindi mo pwede nga, permi na lang yung ginakontrol sa COPD mo. It's not about letting it hold me back, Jal. It's about being realistic and taking care of myself. Fine, but don't come crying to me kung na-mess out ko na sa fun mo. It's not about having fun and Jal. It's about taking care of myself.
Hoy! Nabatian niyo to? Grabe away siyang duwa, no? Pero naiintindihan niyo to? May ara pala kung nabatian ng COPD. Ano naman?
To answer the question of our Marites, COPD is the first respiratory infection based on our list. It is commonly known as chronic obstructive pulmonary disease. The scientific name of the fungus causing infection is Aspergillus fumigatus or simply Aspergillus.
COPD is defined as a common, preventable, and treatable disease that is characterized by persistent respiratory symptoms of airflow irritation that is due to airway or alveolar abnormalities, usually caused by significant exposure to noxious particles or gases.
Bronchitis and emphysema are both progressive lung diseases which can both result in COPD. Smoking tobacco is the main cause of infection and causes up to 90% of COPD cases. Other causes include females 65 years and above exposed to air pollution, work with chemicals or fumes, have alpha-1 antitrypsin deficiency, a genetic risk factor for COPD, and people who have made respiratory infections during childhood.
One person can transmit COPD to another, which means that it is not contagious. But COPD can cause someone to cough a lot, increasing the risk of transmitting other infections like the cold and flu.
Its many signs and symptoms, and the most common ones are coughing with mucus that persists for long periods of time, difficulty taking a deep breath, shortness of breath while mild exercise, and performing regular daily activities like walking or using the stairs and using. By nearly 60% of persons at high risk were in the 45 to 54 and 55 to 64-year-old age groups. Also, between 30% and 50% of people with COPD experience at least one sudden worsening of symptoms per year.
Treating COPD starts with reducing exposure to lung irritants. Quitting smoking and avoiding exposure to smoke and other irritants help the lungs stay healthy. Some medical treatments include bronchodilators, anti-inflammatory medications, supplemental oxygen, antibiotics, vaccinations, rehabilitation, anticholinergics, glucotriene modifiers, expectorants, antihistamines, and antivirals.
Ano naman, bakit mo nasalita? Hindi ka ba okay ko? Hindi, pero wala man lang. Daw ba lang smell mo? Asbestos? Asbestos? Seryoso? Oo, tuod. Considering the age of the building, it's definitely a possibility. So, ginapakita di ka ba? Kasi na-expose na ta? It's hard to say for sure, pero hindi natin i-notify yung university authorities kagang police.
Bila ka may mga kalat dito sa odros. Tapos daw ka ba kung makadto kay ginaisturbo mo raw ang kalat. Basta. Di makadto.
Looks like fake news reached the ear of our Marites. But based on the true story, it wasn't a ghost. The right term for a second respiratory infection is pulmonary fibrosis or interstitial pneumonitis. It is commonly called asbestosis. Asbestosis is not mainly caused by a fungus. Instead, it is because of the prolonged exposure to asbestos fibers. This fungal infection is caused by different types of fungi like Aspergillus and Candida.
There is a much higher chance of developing asbestosis and other related diseases if you smoke. Also, when you inhale asbestosis fibers, they can become embedded in your lungs and lead to the formation of scar tissue. This scarring is known as asbestosis.
Asbestosis is an interstitial lung disease caused by the inhalation of asbestos fibers. These fibers are different mineral silicates and are classified into two main categories based on their shape, that is, serpentine and amphibious.
Entry to the body is inhalation of air and also via ingestion. Also, naturally occurring asbestos can stick to clothing or hair during outdoor activities. People may not even realize they pick up the fibers, and if a person carried asbestos elsewhere, family members or others could experience secondary exposure.
COPD includes many signs and symptoms, and the most common ones are shortness of breath, tightness in chest, persistent dry cough, chest pain, appetite loss, finger clubbing, and nail deformities.
For asbestosis, it's generally adults who have worked in industries where asbestos exposure is common, such as construction, mining, and manufacturing. These individuals are often middle-aged or older. People who develop asbestosis is estimated to range from like 2% to 10%.
There are many medical treatments which can help alleviate asbestosis, which include oxygen therapy, bronchodilators, corticosteroids, pulmonary rehabilitation and vaccinations, and lung transplantation. Some home remedies include avoiding exposure, quitting smoking, using air purifiers, eating a balanced diet, and engaging in gentle exercise.
Thank you, Princess, for recognizing the danger that we talk about. Important is the conscious to the health and safety. This is making more than a minute.
Uy, sige na ako isang wala sa siguro. Pero sa okay ka na? Nagibiro ko lang sa isimo ko masakit ito. Mas kailangan ko lang ako kanina sa hara. Basta lang sa ko na yung wala ko ginawa. Mas serious, ito na ako sa patients. Kaya kung maantro ko pala, ay sila kalabos. Sunod ko lang. It's a viral infection that affects the airways, especially sexual gland. It can cause a barking cough, hoarseness, and difficulty breathing.
For respiratory infections, what is this mysterious infection called croup? Croup is a viral infection, which means that it is caused by a virus called influenza virus. Also, take note that croup is not associated with fungal infections.
Respiratory infection among younger people. It is characterized by the inflammation and swelling of the upper airway, particularly the trachea and the larynx, making it harder to breathe. Taking a breath often produces a high-pitched whistling sound called stridor.
The most common cause of croup is a viral infection. Croup viruses include parainfluenza, influenza, respiratory syncytial virus or RSV, measles, and adenovirus. Rarely, bacteria can complicate the viral infection and make it more difficult to breathe.
Croup is highly contagious because of the viruses that lead to the condition are easily spreadable through the air. When someone with a viral or bacterial infection it can cause croup sneezes or coughs, they send respiratory droplets containing croup-causing germs into the air. When your child breathes in these droplets, it can catch an illness that will cause croup.
Croup often begins as an ordinary cold. If there's enough swelling, irritation, and coughing, a child can develop loud barking cough that may burst by crying and coughing, as well as anxiety and distress, fever, hoarse voice and noise, or labor breathing. Between 6 months and 2 years of age, the highest risk of getting because children have small airways are likely to cause croup. Croup occurs in children older than 6 years of age.
based on research, flu have an attack rate of 5 to 15% among children under the age of 6, but this can vary widely.
Home remedy includes using a cool mist humidifier to help soothe dry and irritated airways. You can also sit with your child in a bathroom filled with steam generated from hot water running in the shower. Treating your child's fever with an over-the-counter or OTC medication such as acetaminophen or ibuprofen. Group treatments may include humidified air or oxygen, IV fluids for dehydration, monitoring of vital signs, including oxygen levels, breathing and heart rate, group medication, including steroids and nebulized breathing treatments, and placement of a breathing tube.
I'm sorry, di ba?
Ah, okay kaso. Okay, Mama Chubby.
Okay, kami ng SARS. There are hindi any contagious.
No, 2000s pa pala.
Oo, pero nagka-comeback siya. Kag-timing, it nalagtan. Siyempre sa akin.
Na, hindi. May mga papahayo.
Oh, hindi, ano naman chismis ko ba?
Wala lang. Survive lang sa midterms.
Bago pa, wala ko na ngayon nasunod ang style schedule ko pag sa SARS ko.
Sabagay. Hindi, ayaw mo na. Gusto ko.
Kaya,
Severe acute respiratory syndrome is commonly known as SARS. It is not caused by a fungal infection but by a virus. This virus is known as severe acute respiratory syndrome coronavirus or simply known SARS-CoV.
SARS is typically classified based on its causative agent, which is the SARS coronavirus. SARS is caused by a virus associated with the Coronaviridae family, specifically the genus Beta coronavirus. It can also be classified into mild, moderate, severe, or critical based on the seriousness of symptoms and the impact on the health of the patient.
SARS is caused by a strain of coronavirus, the same family of viruses that caused the common cold. Previously, these viruses had never been particularly dangerous to humans. The virus can, however, cause severe diseases in animals, and that's why the scientists suspected that the SARS virus might have passed from animals to humans. The primary mode of transfer of SARS is through respiratory droplets generated when an infected person coughs, sneezes, or coughs. The main modes of transmission for SARS is by having close contact with an infected person, catching respiratory droplets, making contact with contaminated surfaces, and by airborne transmission, which is rare.
SARS usually begins with flu-like signs and symptoms. Fever, chills, muscle aches, headaches, and occasionally diarrhea. After about a week, signs and symptoms include fever of 100.5 degrees Fahrenheit or higher, dry cough, and shortness of breath.
Most patients identified with SARS were previously healthy adults, aged 25 to 70 years. A few suspected cases of SARS have been reported among children under 15 years of age. The case fatality among persons with illness meeting the current WHO case definition for probable and suspected cases of SARS is around 3%.
There are no specific home remedies or OTC medication for SARS. Treatment focuses on supportive care, including rest, hydration, and fever management with medications like acetaminophen. Severe cases may require hospitalization for oxygen therapy and mechanical ventilation, which is why consulting a healthcare professional is crucial for proper management.
Respiratory syncytial virus is commonly known as RSV, which is known to cause respiratory tract infections. It is not caused by a fungus but by a virus. RSV is a virus belonging to the Paramyxoviridae family, genus Orthoneumovirus.
RSV is classified as species, human or virus. The classification provides due to the genetic makeup and relationship of RSV with other viruses in the general. In adults and older, healthy children, respiratory syncytial virus symptoms are mild and typically mimic the common cold.
Respiratory syncytial is caused by a virus entering the body through the eyes, nose, or mouth. It spreads easily through the air in uninfected respiratory droplets. You or your child can become infected if someone with RSV coughs or sneezes near you.
An infected person is most contagious during the first week or so after infection.
RSV is spread from person to person through close contact with someone who is infected via secretions from coughing and sneezing or touching objects such as toys or doorknobs that have the virus on them. It takes between 2 and 8 days from the time of exposure for someone to become ill.
Signs and symptoms of respiratory syncytial virus infection most commonly appear about 4 to 6 days after exposure to the virus. In adults and older children, RSV usually causes mild cold-like signs and symptoms. These may include congested or runny nose, dry cough, low-grade fever, sore throat, sneezing, headache, cyanosis, and lethargy.
Children at greatest risk for severe illness from RSV include premature infant up to 12 months old, especially those with symptom number. Attack rates may fluctuate depending on passage stage, season, geographic location, and population immunity. However, RSV infections are relatively common, particularly during moisture and mild climates.
Remedies include honey, humidifiers and vaporizers, baths, sprays, nasal suctioning, and deep breathing. For babies before or during their first RSV season, it is important to have their vaccination of Beyfortus or nirsevimab, which is a single-dose monoclonal antibody given in one shot into the muscle. It puts antibodies into the bloodstream that will help babies fight the virus. For adults, they should drink lots of fluids, rest, and take Tylenol or acetaminophen to reduce fever and pain. Antibiotics aren't prescribed for RSV because it's a viral illness, not a bacterial infection.
What is this mystery?
Signs and symptoms of respiratory
Hoy, nabatian niyo to? Thank you for watching our video.
Among others,